Hi, my name is Monica Videira, and I am a psychotherapist and counselor based in Archway, North London, where I work both in person and online. I have worked in the NHS and private practice for many years, and I specialize in anxiety disorders, depression, complex emotional needs, and personality disorder. Today, I will be talking about schizotypal personality disorder, or simply schizotypal disorder. It's one of the least understood and known personality disorders. Let's start with the symptoms. So, some schizotypal disorder symptoms are preference for solitary activities and lack of close friendships or relationships outside the immediate family, a flat affect, or inappropriate emotional responses that might not fit the social context, persistent and excessive social anxiety, misinterpretation of events, often perceiving random situations as having personal significance, suspiciousness and paranoid ideation that doesn't go away with familiarity, unusual sensory experiences, such as sensing the presence of a person that is not physically present, peculiar or eccentric dress habits, ways of speaking, thinking, and behaving that might seem off or odd to others. Because it is a personality disorder, individuals might describe having always been like this. And these ways of thinking, behaviors, these experiences, they tend to be stable through time, which does not mean that they cannot be treated or improved. We don't know exactly what the causes of schizotypal personality disorder are, but research suggests a combination of genetic predispositions, environmental influences, and developmental factors such as childhood trauma or neglect. In fact, in their early and teenage years, it is common for people with this disorder to perform poorly in academic settings or appear socially disconnected from their peers, potentially resulting in teasing or bullying, which is the reason they often come for therapy. Being a fairly unknown diagnosis, it's important to debunk some myths. Firstly, schizotypal disorder is not schizophrenia, although some research suggests that they exist in a spectrum with schizotypal on one end and paranoid schizophrenia on the other. People with schizotypal personality disorder are in touch with reality, though they may have unusual interpretations of it, and they don't tend to experience hallucinations or delusions in the same way someone with schizophrenia does. Another myth is this is not simply being quirky or eccentric, because it actually significantly impairs a person's life, relationships, and it does cause a lot of suffering. Thirdly, people with schizotypal disorder are not inherently violent or dangerous. They're actually much more likely to be withdrawn and isolated. And finally, schizotypal personality disorder is treatable. Living with this condition can be challenging, but with appropriate treatment and support, individuals can learn to manage their symptoms and lead fulfilling lives. Medication can help with associated conditions such as anxiety or depression, but it's not the first point of call in the treatment of personality disorder. Psychological therapies, such as cognitive behavioral therapy, they can help individuals identify and challenge unhelpful thought patterns and develop better coping mechanisms. CBT can also help improve social skills and reduce anxiety in social situations, which are some of the main difficulties for people with schizotypal disorder. Another therapy that can be useful and helpful is psychodynamic psychotherapy. And it helps by exploring the unconscious conflicts, early life experiences, and internal dynamics that contribute to the individual's current symptoms and behaviors. This therapy also helps uncover underlying psychological issues, enhance self-awareness, and promote healthier ways of relating to oneself and others. Family and social interventions, including group work, can also be helpful to develop self-awareness, learn more effective ways of relating to others, and build social skills. Regardless of the model, psychological treatment for schizotypal personality disorder is typically long-term, and it requires a strong therapeutic relationship between the individual and the therapist. The goal is not just symptom reduction, but also achieving meaningful personal growth, enhanced self-awareness, and improved emotional well-being, which can take time. However, it is crucial to remember that seeking help is a sign of strength, not weakness. If you or someone you know thinks that they're struggling with schizotypal disorder, please reach out to a qualified professional, such as myself or my colleagues in the counseling directory. Wish you all the best. Thank you very much for your attention.